Hello, this is Dr. David Tam, President and CEO of Beebe Healthcare, and welcome to another edition of Tuesdays with Tam, where we talk about what we're doing here at Beebe Healthcare and the physicians and the providers and the services that we are bringing to Sussex County. And today I'm very excited because we have a very special guest. Dr. Diana Dickson-Witmer is joining us. And this is something that's so exciting for me. It's something we've been working so hard to do that it's actually going to be up front, I'll tell you, a three-parter. But today we're going to have a few moments where we can talk to Dr. Diana Dickson-Witmer and have her talk a little bit about her vision, her experience, and what she's so excited to do here at Beebe Healthcare. Now, Dr. Diana Dickson-Witmer is a board-certified surgeon, and she just joined Beebe with decades of experience and expertise in the field of breast surgery and oncology. And in addition to her surgical and patient care experience, Diana is known for her trailblazing work in the field of breast surgery, setting the standard and developing the programs to train future surgeons in the field. So I hope it's okay to call you Diana, but it is a privilege to introduce you to Sussex County. And how are you doing today?
I am doing fine, David. Absolutely fine. And I'm very happy to be here.
Well, I hope you'll take a moment and tell our Sussex County viewers a little bit about who you are.
I am a general surgeon by training. I did 25 years of general surgery and trauma surgery. Actually set up a treatment center at Ground Zero after 9/11. But the last decade or more of my career has been exclusively treating breast. And I've always had a particular interest in breast disease and had in fact developed a breast center with stereotactic core biopsy and small operating room for outpatient procedures when I was in private practice. And then when I became a part of the larger hospital system, I created a breast center for that hospital system. So I am a breast surgeon now, general surgeon by original training. And I have a husband and a son who's a surgery resident in Chicago. My husband is a general surgeon also with a particular interest in breast. And I have two miniature schnauzers.
Well, now the schnauzer part is always interesting. I know that the people here in Sussex County love to hear about my chocolate lab Coco and of course the two cats. We are a family oriented, family focused community. Where are you from originally?
I'm from New York originally, but I've lived in Delaware more than any other place in my life. I've been in Delaware since 1979, and I originally was going to do theater, and that career was hampered by only a couple of small problems. One, my dad died when I was 17, so I had to actually earn a living at something. And two, I had zero talent whatsoever. So between those two factors, I went another direction and went into medicine.
And any place else that you've been in the country?
I went to college at Sarah Lawrence in Bronxville. Then I went out to Berkeley and was at Berkeley studying dance under Alvin Ailey and his troupe and embryology. And then I got accepted to University of Florida for medicine. So I was in Gainesville, Florida, and I was there for 7 years. I did medical school and 3 years of general surgery there. And then I transferred to what was then Wilmington Medical Center, then the Medical Center of Delaware, and now Christianacare. Finished my residency and did my chief resident year in Wilmington. Met my husband, who was a junior resident, and he wanted the weekends to be that you were never on more than one day at a time. You were on Friday, then off Saturday, on Sunday, and I wanted the weekends to be blocks of time so that you could be on and you're on the whole weekend. For the other weekend, you could get out of town. So his story is that when I was chief resident and I made out the schedule, that he said, I'll make you a deal. If you make the schedule out so that we never have to do a whole block the weekend all at once, I'll marry you. He insists that that's how it went down and that I said yes, and so we did get married. But we've been married since 1982 and very happily so.
Well, you know, I've had the chance to, of course, have dinner with the two of you, and I can tell it's not just a schedule, but it's actually a really loving relationship that probably got you guys married. So, you know, you've had such a interesting journey, and we're going to talk more in other segments about that. But, you know, you are one of the preeminent breast surgeons here in Delaware, and you're joining a great team here. Why did you choose to join Beebe Healthcare as the next step in your storied career?
Well, I had, as I said, created a breast center in private practice. I created a breast center for Christiana, and actually I created a breast surgical oncology fellowship at Christiana to train future breast surgeons. And what Beebe offered me was the opportunity to come somewhere where there is excellent breast surgery already. Dr. Jim Spellman and others are doing a wonderful job, but there is an opportunity here with the particularly retirees moving to this area. The Wall Street Journal says that Delaware is tied with Montana to be the retiree destination most popular in the whole country. So I wanted to do something that would help my community. Specifically, I wanted to be able to work with the existing good program to take it to the next level so that people in Sussex County would never feel that they need to travel outside of this immediate area for the best possible care for breast disease. And they don't have to. It's all here. We need to put it into packages that they recognize as being equal or better than anything that they would find somewhere a 2-hour drive away. And that is a really exciting proposition to me. I believe I can do it, and I see all around me help from all quarters and enthusiasm from the community and from Beebe Healthcare about taking this breast program to the next level.
Well, that's really you know, exciting, Dr. Dickson-Witmer. As you know, as everybody knows, we are building that next generation of care, and so it's not because something's bad, but we want to expand it and grow it and make it more innovative so that people who are here, and as you said, growing population, don't have to go other places. So I'm really excited that you're here, and I'm really excited that we have this 3-parter to talk a little bit more about you and what Beebe Healthcare is doing to grow and advance breast health and breast health care here in Sussex County. So that's all the time we have for today, but this special edition of Tuesdays with Tam will actually, like I said, be a 3-parter. Next week, we'll be back chatting with Dr. Diana Dickson-Witmer to learn a little bit more about her storied career and trailblazing work in the field and how that will translate to really bringing the advanced care needed to the people here of Sussex County. Thank you, Diana, and we'll talk to you soon.